This is the recording for gas exchange. Gas exchange is defined as the process by which oxygen is transported to the cells and carbon dioxide is transported from the cells. For this normal physiologic process to occur, chemoreceptors in the medulla sense carbon dioxide levels. When the carbon dioxide level is elevated, these receptors transmit impulses to the diaphragm and intercostal muscles to contract. As the diaphragm contracts, negative pressure pulls in 21% oxygen from the atmosphere. Head injuries, drug overdoses, and post-operative anesthesia can impact this normal physiologic process from occurring. Age-related differences. Babies after 30 weeks gestation have sufficient surfactant to prevent the alveoli from collapsing upon exhalation. Infants are primarily nose breathers until 3 months. Should their nasal passages become occluded, they may have difficulty breathing. To clear the nasal passages, you're going to use a bulb syringe. The bulb syringe is depressed, inserted into the nose, and released to remove those secretions by sucking them out. For older adults, diminished strength of respiratory muscles reduces the maximal inspiratory and expiratory force. This may result in a weaker cough. The alveoli become less elastic and more fibrous, causing dyspnea more frequently. Older adults experience a reduction in erythrocytes, which increases their risk of anemia. So just to reinforce that populations at greatest risk for alterations in gas exchange are infants, young children, and older adults. Risk for aspiration increases during an altered state of consciousness, such as chemical alteration, alcoholism, drug overdose, or anesthesia, or from a neurological disorder, head injury, seizure, and stroke. Please know the difference between your normal assessment findings and your abnormal assessment findings. Also, you're going to need to know how was a respiratory intervention such as suctioning effective. So normal assessment findings: breathing is quiet, normal, breathing is quiet, effortless, appropriate for rate is appropriate for age, SAT is between 90 and 100, nail beds, skin, lips are appropriate for the patient's race. Your thorax is symmetric and expanding equally. Your trach is midline, and you have clear bilateral breath sounds. When a cough is reported or observed, the patient should be asked if the cough causes fatigue or interferes with sleep. If their cough is interfering with sleep, we may give them a cough suppressant. So now these are our abnormal findings, or if we're having inadequate gas exchange. We're going to have an increased respiratory rate, decreased SAT, increased heart rate, increased temperature. An increased respiratory rate may be due to increased work of breathing. The SAT may be below 95 when oxygen is not being transported by hemoglobin to the cells. Tachycardia may occur from anxiety or from not being able to breathe well or from anemia. Temperature may be elevated because of an infection such as pneumonia. Another thing that you may see is mental status. If you're having inadequate gas exchange, you may have confusion or a decrease in mental status or impaired mental status. So if I suspect a pneumothorax, we're going to have uneven chest expansion, and we're going to have absent breath sounds on the side of the pneumothorax, and the trachea is going to be deviated. Sputum specimens can help in the diagnosis of respiratory disorders. If I need to collect a sputum specimen, you can have, or I could go in and have the patient use their incentive spirometer to kind of get those deep breaths in and aid in the collection of a sputum sample. Our skin TB test, or the little bleb that we do under our skin is to test for TB. Pulmonary function tests assess the presence and severity of diseases in large and small airways. Bronchoscopy is an endoscopic examination with a flexible fiber optic bronchioscope, and it's extended through the bronchi for the purpose of diagnosis, specimen collection, or biopsy. Primary prevention. Infection control is one of the simplest primary prevention measures in infection control. Proper hand hygiene helps to prevent respiratory tract infections. All individuals should be taught the importance of hand hygiene and proper hand washing technique. In addition, individuals should be instructed to clean surfaces that are frequently touched, such as doorknobs and countertops. Coughing and sneezing into a tissue or into the elbow or sleeve reduces particles in the air. Avoid large groups of people, reduces the airborne transmission of microorganisms. Smoking cessation is important for primary prevention. Unfortunately, quitting smoking is difficult and may require multiple attempts. Often smokers report lack of success in smoking cessation because of stress, weight gain, withdrawal symptoms including irritability, anxiety, difficulty concentrating, and decreased appetite. Immunizations are going to be our best way to prevent disease. After a surgical procedure, patients are encouraged to cough and deep breathe at least every 2 hours and/or use an incentive spirometer to prevent pneumonia and atelectasis. The device encourages deep breathing for patients and measures the air inhaled as an outcome indicator that is useful for nursing assessment. So how does an incentive spirometer work? The patient is placing it on their lips and they're taking a deep breath in. They're breathing in, and it is encouraging full expansion of the lungs. If you have a child that needs to use an incentive spirometer and they're having a difficult time, you can have them suck on a straw just to encourage that lung expansion. Antihistamines reduce the symptom or relieve the symptoms of sneezing, rhinorrhea, and nasal itching experienced in allergic rhinitis. Glucocorticoids reduce bronchial hyperactivity that occurs in asthma by suppressing inflammation. Mucolytics react directly with the mucus to make it more liquid. Expectorants cause the cough to be more productive by stimulating the flow of the respiratory tract secretions. Coughing is a protective mechanism and is useful to expectorate sputum. However, when coughing is chronic and non-productive, it may prevent sleep or tire the patient, making a cough suppression therapeutic. Most antitussives act within the central nervous system. Antimicrobials. Respiratory tract infections are treated with antimicrobials to kill or limit the growth of microorganisms. When our patient is taking an antimicrobial, we need to teach them that they need to complete the antibiotic regimen to prevent infections from reoccurring. Delivery of humidified oxygen is a cornerstone of gas exchange intervention. Nurses collaborate with respiratory therapists to supply patients with oxygen and teach them how to use oxygen at home if applicable. Teach patients about the safety of using O2 at home. Do not use O2 around flammable materials or fire. Also teach them to look for tissue breakdown. The area to be assessed will be dependent on the device used for oxygen delivery. Excuse me. Most people are on a nasal cannula at home. So we want to teach them that we want to assess the areas underneath the nose, on the top of the cheeks, and the ears, and behind the ears. Bronchoscopy, a diagnostic effect, is directly visualizing the airway or taking a tissue sample. Nutrition therapy is needed to provide energy for increased work of breathing and to support the immune system. High protein, high calorie, nutritious foods and drinks meet the needs of these patients. Small meals are advised for patients who become dyspneic while eating. For patients with a productive cough, oral care should be provided before meals to reduce the lingering taste of sputum. Positioning. Two positions are important for patients with impaired gas exchange. The first position is sitting up. Patients with acute or chronic impaired gas exchange breathe more easily in high Fowler's, or semi-Fowler's position. So again, they want the high calorie, high protein, nutritious foods. Which of the following conditions might require suctioning to improve gas exchange? So it's going to be COPD because we have the hypersecretion of mucus. So let's go ahead and get asthma covered. Asthma is a chronic disorder characterized by periods of reversible airflow obstruction. So we have the wheezing, the coughing, dyspnea, chest tightness. So COPD is characterized by chronic airflow limitation that is not fully reversible. COPD includes two obstructive airway diseases, chronic bronchitis and chronic emphysema. Chronic bronchitis, it develops when hypersecretion of mucus obstructs the trachea and bronchi, caused by irritants such as cigarette smoke, air pollution, respiratory infection. Symptoms are productive cough, dyspnea on exertion. Lung cancer is an uncontrolled growth of aplastic cells in the lungs, described as lung cancer. Pneumonia is an inflammation of the terminal bronchioles and alveoli, resulting in pneumonia. Microorganisms are the most frequent cause. Anemia. So we have low red blood cells. Pulmonary emboli, a blockage of the respiratory arteries by a thrombus, fat, or air, or tumor creates a pulmonary embolism. Okay, so nursing interventions to assist with alterations in oxygenation. So we want to assist our patients with oral or nasal hygiene. We want to assist them into a position that facilitates breathing. So semi-Fowler's or high Fowler's. If a patient is laying down and they're having difficulty breathing, we can sit that patient up. We want to encourage incentive spirometer use, and we want to encourage coughing and deep breathing. Okay, so that is going to conclude the recording for gas exchange.